Hi, my name is Mike Ward, and I'm the Senior Benefits Director for the Ascension Group. And I want to thank you for taking your time to allow me here to educate you today. Be sure to click on the subscribe button so you can watch future educational videos. And we look forward to helping you stay up to date with the best insurance policies, wealth strategies to maximize your protection and help you reach your financial goals. This video, entitled 2017 Medicare Getting Started, is designed to provide you an overview of the Medicare basics, including Part A, which is the hospital insurance, Part B, which is the medical insurance, Medicare supplement insurance, also known as Medigap, Part C, the Medicare Advantage plans, Part D, the prescription drug coverage, and also the federally facilitated health insurance marketplace, Medicaid, and other programs to help people with limited income and resources. Now, Medicare currently provides health insurance for 55 million U.S. citizens, and Medicare health insurance for people is basically generally for three groups of people. You have those that are 65 and older. You have people under 65 with certain disabilities who have been entitled to Social Security disability insurance benefits for 24 months, including ALS, which is also called Lou Gehrig's disease, without a waiting period. Now, people of any age who have end-stage renal disease, which is a permanent kidney failure that requires regular course of dialysis or a kidney transplant. And a very small subject of individuals that have been federally declared an environmentally hazard, health hazard, asbestos related. And so note, to get Part A and or B, you must be a U.S. citizen or lawfully present in the United States. And if you live in Puerto Rico, you must be actively enrolled in Part B. Now, who runs Medicare? It's actually the Centers for Medicare and Medicaid Services who administers the program. And however, basically the Social Security is responsible for enrolling most people for Medicare. And for more information, you can always go to socialsecurity.gov, and you can also visit cms.gov to go over to CMS. Now, if you're a railroad retiree, the Railroad Retirement Board will handle your enrollment. And so for more information, you can always go to rrb.gov. Now, with Medicare, it actually covers many types of services, and you have options for how you get your Medicare coverage. Medicare has four parts. Part A, again, which is the hospital insurance. It helps pay for inpatient hospital stays, skilled nursing facilities, home health care, and hospice care. And you have Part B, which is the medical insurance. Now, this help covers medically necessary services like doctor visits and outpatient care. And Part B covers many prescription services, preventative services, including screening tests and shots, diagnostic tests, some therapies, and durable medical equipment like wheelchairs and walkers. Now, together, Part A and Part B are also referred to as Original Medicare. And Part C is actually the Medicare Advantage programs. Now, with this is another way to get your Medicare benefits. It combines Part A and also Part B, and sometimes Part D, the prescription drug coverage. Now, these plans are managed by private insurance companies approved by Medicare, and these plans must cover medically necessary services. However, plans can charge different co-payments, co-insurance, and also deductibles for their services than Original Medicare. Now, Part D, which is the prescription drug coverage, helps pay for outpatient prescription drugs, and Part B may help to lower your prescription drug costs and prevent you from future drug costs. Now, there are two main ways to get your Medicare coverage: Original Medicare or Medicare Advantage, and you can decide which way to get your coverage. Now, original Medicare includes, again, Part A, the hospital insurance, and Part B, the medical insurance. And you choose to buy Medigap policy to cover some of the costs not covered by original Medicare. You can also choose to buy a Medicare prescription drug coverage, Part D, from a Medicare prescription drug plan. Now, Part C is like a health maintenance organization, HMO, or a preferred provider organization, a PPO, and it covers Part A and Part B services and supplies. And there are also may include Medicare prescription drug coverage, and you can add a Medicare prescription drug plan to a Medicare private fee-for-service plan, or cost if they don't provide a Part D coverage. And you can add it to a Medicare savings account, MSA plan, and you can't add a Part D plan to a Medicare HMO or PPO plan without drug coverage. Now, Medigap policies don't work with these plans. If you join a Medicare Advantage plan, you can't use a Medicare supplement insurance, also known as Medigap, policy to pay for out-of-pocket costs while you're enrolled in a Medicare Advantage plan. So it's very important to note that. Now, if you're already getting Social Security or Railroad Retirement Board benefits, for example, getting early retirement at least 4 months before you turn 65, you'll be automatically enrolled in a Medicare Part A and Part B without additional application. You're getting your initial enrollment package, which includes your Medicare card and other information, about 3 months before you turn 65. And coverage begins the first day of the month you turn 65, or 3 months before your 25th month of disability benefits. Coverage begins your 25th month of disability benefits. Now, if you're not getting retirement benefits from Social Security or the RRB, you must sign up to get Medicare. When you have the original Medicare, you use your red, white, and blue Medicare card when you get your health card services. And the Medicare card shows the type of Medicare coverage, Part A and or B, you have, and the date coverage started. Your card may look slightly different from this one, and it's still valid. Now, the Medicare card also shows your Medicare claim number. And for most people, the claim number has 9 numerals and 1 letter. And there also may be a number or another letter after the first letter. Now, the 9 numerals show which Social Security record your Medicare is based on. The letters the letters and numbers tell how you're related to the person with that record. For example, if you get Medicare on your own Social Security record, you might have the letters A, T, or M, depending on whether you get Medicare and Social Security benefits or Medicare only. And if you get Medicare on your spouse's record, the letters might be a B or a D. And for railroad retirees, these are numbers and letters in front of the Social Security number. These letters and numbers have nothing to do with having Medicare Part A or B, and you should contact Social Security or the Railroad Retirement Board if you have any railroad retirement benefits, if any information on the card is incorrect. And if you get your Medicare card in your initial enrollment period package and don't want Part B, follow the directions and return the card. And we'll talk more about that and about the reasons why you might want to delay taking Part B. And if you choose a Medicare Advantage plan, your plan may actually give you a card to use when you get your healthcare services and supplies. Now, if you're not getting any Social Security or railroad benefits at least 4 months before you turn 65, for instance, because you're still working, you'll need to sign up for Part A and Part B. Even if you're eligible to get Part A premium free, you should contact your Social Security 3 months before you turn 65. And if you work for a railroad, contact the RRB to sign up. You don't have to be retired to get Medicare. The 1983 Social Security amendments included a provision for raising the full retirement age. And Congress cited improvements in the health of older people and increases in average life expectancies as primary reasons for increasing the normal retirement age. Full retirement age, also called normal retirement age, has been 65 for many years. And however, beginning with people born in 1938 or later, that age gradually increases until it reaches 67 for people born after 1959. And for more information or to calculate your age for collecting full Social Security retirement benefits, go over and visit ssa.gov. And then also note, although the age to get full Social Security retirement benefits is increasing, Medicare benefit eligibility due to age still begins at age 65. And so there's also some numbers that you can call here in order to get enrolled with your Social Security. So note those numbers. And again, we'll talk more about that. Now, your first opportunity to enroll in Medicare is during your initial enrollment period, which lasts 7 months. And your coverage starts based on when you enroll. So if you enroll during the first 3 months of your initial enrollment period, that's the 3 months before the month you turn 65, your coverage will begin the first day of the month you turn 65. And if you enroll the month you turn 65, your coverage will begin the first day of the next month. And if you enroll in the last 3 months of your initial enrollment period, the 3 months after you turn 65, your coverage will begin 2 to 3 months after you turn 65. And if you're eligible for premium-free Part A, you can enroll in Part A. And once your your initial enrollment period begins, 3 months before you turn 65 and any month after. If you're not eligible for premium-free Part A, you can only enroll in Part A during your initial enrollment period or during the limited Part B enrollment periods. And only people who don't qualify for Part A must pay a premium for Part A coverage. And you must pay a monthly premium for both Part B and premium Part A coverage. Now, if you enroll in a free Part A later, your Part A coverage will start 6 months back from the date Social Security determines you're eligible. Now, this also is required by law, and you can't pick your free Part A start date. The date free Part A begins is important if you contribute to a health savings account, an HSA. And because you can't deposit money in your HSA for 6 months before your Part A start date. And if you contribute to your SSA after your Medicare coverage starts, you may have to pay a tax penalty. And for everyone, whether you get premium free A or have to pay a premium for it, you can only enroll in Part B during your initial enrollment period and the annual general enrollment period, which is from January 1 through March 31st each year. And in limited situations, a special enrollment period may also be the case. And if you don't enroll in Part B or premium Part A during your initial enrollment period, you may have to pay a penalty. And so for Part B, it's a lifetime penalty as long as you have Part B. So basically, with the general enrollment period, if you didn't sign up for Part B or Premium Part A during your initial enrollment period, your IEP, you can get enrolled during the general enrollment period. And the general enrollment period occurs January 1 through March 31st each year. And if you enroll in the GEP, your coverage will begin July 1st. And if you're eligible, if you aren't eligible for a premium-free Part A and you don't buy it when you're first eligible, your monthly premium may go up 10%. And you'll have to pay the higher premium for twice the number of years you could have had Part A, but didn't sign up. And generally, if you don't take Part B when you're first eligible and more than 12 months have passed since you turned 65, you'll likely have to pay a penalty that adds to your monthly Part B premium. And the Part B penalty is 10% for each year, each full 12-month period you could have had Part B, but didn't sign up for it. And in most cases, you'll have to pay this penalty for as long as you have Part B. Very important to note there. So basically, there are a few special enrollment periods called SEPs for Part B and Premium Part A allowed by law. And most people don't qualify for a special enrollment period. However, if you're still working, you may be eligible. And the SEP allows you to enroll after your initial enrollment period and not wait for the general enrollment period. And you won't have to pay a penalty. So to be eligible, you must have employer group health plan coverage based on active current employment. And if you're 65 or older, you must get that employer-sponsored coverage based on your or your spouse's current employment. And if you have Medicare-based disability, you can also have the employer sponsored coverage based on a family member's current employment. And you must have the EGHP coverage, for all the months you were eligible to enroll in Part B, but didn't. And for most people, this means you had the EGHP coverage since you turned 65. And if you're eligible, you can enroll using the SEP at any time while you have the EGHP coverage based on active current employment. And if you lose either the EGHP coverage or the current employment, you have 8 months to enroll. And if you didn't enroll within the 8 months, you'll have to wait until the next general enrollment period to enroll. And you'll have a gap in the coverage and may have to pay a penalty. So it's important to note that the Consolidated Omnibus Budget Reconciliation Act, COBRA basically, retiree coverage, long-term workers' compensation, or veterans affairs coverage isn't considered active current employment. And so you should contact your employer or union benefits administrator to find out how your insurance works with Medicare and if you will be able to take advantage to delay Part B enrollment. Okay, so, decision. Now, how do I want to get my Medicare coverage? There are some decisions you'll need to make about your Medicare coverage, including the following. Do I want original Medicare, or should I consider a Medicare Advantage plan? Should I take, Part A or Part B, and when? And do I need a Medigap policy? What about Part D? And what do I need to do if I'm not retiring at age 65? So basically, original Medicare, with Part A, the hospital insurance, it helps cover medically necessary inpatient services. And so you've got the hospital inpatient care, semi-private rooms, meals, general nursing, other hospital services and supplies, as well as care in inpatient rehabilitation facilities and inpatient mental health care in psychiatric hospitals, lifetime 190-day limit. You have inpatient skilled nursing facilities, care under certain conditions. And you've got blood. In most cases, if you're in need of blood as an inpatient, you won't have to pay or replace it. If you got certain inpatient health care services in approved religious non-medical health care institutions, and Medicare will only cover the inpatient non-religious non-medical items and services, and examples include room and board, or any item or services that don't require a doctor's order or prescription, and like unmedicated wound dressings or use of a simple walker. You've got home health care, a doctor or certain health care providers who work with the doctors must see you face to face to certify that you need that home health services, and you must be homebound, which means that leaving home is a major effort. You also got hospice care, and that's your doctor must certify that you're expected to live 6 months or less. And coverage includes drugs for pain relief, symptom management, medical, nursing, and social services, and services Medicare usually doesn't cover, such as grief counseling. And note, Medicare doesn't pay for your hospital or Medicare bills if you're not lawfully present in the United States. Very, very important. Also, in most situations, Medicare doesn't pay for your hospital or medical bills if you're incarcerated, if you go to jail. So paying for Medicare Part A. Now there are costs you pay in original Medicare, and the actual dollar amounts are updated yearly. And to see the most current amounts, visit Medicare.gov. And this is what you pay per benefit period, discussed basically on the next page. I'll be talking about it for Part A and coverage medically necessary services, such as hospital inpatient stay. Again, go over to Medicare.gov. And the deductible amount for days 1 through 60, a fee for coinsurance per day for days 61 through 90, a fee per lifetime reserve day after day 90 of each benefit period, up to 60 days over your lifetime, and all costs for each day after the lifetime reserve days. Inpatient mental health care in psychiatric hospitals limited to 190 days in a lifetime. You got the skilled nursing facilities care, and so that's 0 for the first 20 days of each benefit period. You've got a fee for coinsurance per day for days 21 through 100 of each benefit period, and all costs after day 100. You've got the home health services. You've got $0 for home health care services and 20% of the Medicare approved amount, the coinsurance, for durable medical equipment for providers accepting assignment must use a contract provider if a competitive bidding area. Also note, if you can't afford to pay the cost, there are programs that may help, and these programs are discussed a little bit later here. So a benefit period refers to the way the original Medicare measures your use of hospital and skilled nursing facility services, and a benefit period begins the day you're admitted as an inpatient in a hospital, or again, a skilled nursing facility. And the benefit period ends when when you haven't received any inpatient hospital care or skilled nursing care for 60 days in a row. And if you go into a hospital or again a skilled nursing facility after one benefit period has ended, a new benefit period begins. And you must pay the Part A in-hospital deductible for each benefit period, and there's no limit to the number of benefit periods you can have. So for example, if you spend 5 days in the hospital, you then enter a skilled nursing facility for 20 days of rehabilitation, and you then return home. Your benefit period will end when you have been out of the skilled nursing facility for 60 days or 85 days after you first entered the hospital. And if you don't return to the hospital as an inpatient in that time frame, you'll pay another deductible for the next benefit period. Also, that's another example here. You've returned home after being an inpatient in the hospital or combination of hospital and skilled nursing facility. After 2 weeks at the home, you must return to the hospital, and you haven't been out of the inpatient care for 60 days. So you're still in the first benefit period, and you don't have to pay another hospital deductible. Note, to qualify for the skilled nursing facility services, you must have been an inpatient of a hospital for a medically necessary stay of at least 3 consecutive calendar days, and the 3 consecutive calendar days requirement can be met by stays totaling 3 consecutive days in one or more hospitals, and in determining whether the requirement has been met, the day of admission, but not the day of discharge. It is counted as a hospital inpatient day. It's important to note that an overnight stay doesn't guarantee that you're an inpatient. An inpatient hospital stay begins the day you're formally admitted with the doctor's orders. Now, if you're receiving Social Security or Railroad retirement benefits at least 4 months before you turn 65, you'll be automatically enrolled in free Part A. And if you don't get in Part A automatically, you should consider signing up for Part A when you're first eligible and during your IEP. Now, most people don't pay a monthly premium for Part A coverage because they or their spouse paid Medicare taxes while working. And if you aren't eligible for free Part A and you don't buy it when you're first eligible, your monthly premium may go up 10% for every 12 months you didn't have coverage. And you'll have to pay the higher premium for twice the number of years you could have had Part A but didn't sign up. And the 10% premium surcharge will apply only after 12 months have elapsed from the last day of the initial enrollment period to the last day of the enrollment period you used to enroll. In other words, if it's less than 12 months, the penalty won't apply. This penalty also won't apply to you if you're eligible for special enrollment period. Remember, if you're only eligible for a special enrollment period if you or your spouse or family member, if you're disabled, is actively working and covered by a group health plan through the employer or union benefit on that work, or during the 8-month period that begins the month after employment ends or the group health plan coverage ends, whichever happens first. And if you're still working or have coverage through a spouse, talk to your employer benefits coordinator to learn how enrolling in Medicare or delaying enrollment will affect your employer coverage. You can no longer contribute to a health savings account if you have Medicare, and talk to your company's benefit administrator about when you should stop contributing to the HSA if you plan to sign up for Medicare. You may have to stop contributing to your HSA up to 6 months before your Medicare starts, and you can withdraw money from your HSA after you enroll in Medicare to help pay for medical expenses like deductibles, premiums, and co-payments. And if you contribute to your HSA after that point, after you have Medicare, you could be subject to a penalty by the IRS. So you want to go over to the IRS and basically read up on that. Okay, so now the decision. Do I need to sign up for Part A? Now, basically you want to consider, it's free for most people. You can pay for it if it's your work history isn't sufficient. There may be a penalty if you delay. And basically, again, remember, you want to make sure your spouse is actually working, covered by the employer plan, and etc. So basically, when it comes to Part B, the medical insurance, it basically helps cover everything from medically necessary outpatient services and supplies, and it also covers the doctor services that are medically necessary. Outpatient medical and surgical services and supplies for approved procedures like x-rays or stitches. Also, the clinical laboratory services, blood tests, urinalysis, and some screening tests. Also covers the durable medical equipment like walkers and wheelchairs, and you may need to use certain supplies under the durable medical equipment, prosthetics, other supplies, and other things like that of that nature. And so you want to go over to Medicare.gov to look at that list of supplies. Also, diabetic testing supplies. You may need to use specific suppliers for some types of diabetic testing supplies. So you want to check up on that. And then preventative services such as exams, tests, screenings, and shots to prevent, find, or manage a medical problem. So basically what you have to pay, Part B premiums. Now for Part B each month, the standard Part B premium amount in 2017 is $134 or higher depending on your income, and the average premium is $109 if receiving Social Security benefits. So basically, Social Security will tell you the exact amount you will pay for Part B in 2017. And then remember, the premium may be higher if you didn't choose Part B when you first became eligible. So the cost of Part B may go up to 10% for each 12-month period that you could have had Part B but didn't take advantage of it. And an exception would be if you can enroll in Part B during a special enrollment period because you or your spouse or a family member, if you're disabled, is still employed and you're covered by a group health plan through that employment. Now, you'll pay the standard premium, $134 or higher in 2017 if you enrolled in Part B for the first time in 2017. You don't get Social Security benefits, are directly billed for your Part B premiums, have Medicare and Medicaid pays your premiums. Your state will pay the standard premium amount of $134, and had a modified adjustment gross income as reported on your IRS tax returns from 2 years ago is above a certain amount. And if so, you'll pay the standard premium amount and an income-related monthly adjustment amount. And this is an extra charge added to your premium. Okay, so since basically 2007, people with Medicare with higher incomes have paid higher Medicare Part B monthly premiums, and these income-related monthly premium rates affect roughly about 5% of people with Medicare. And so the total Medicare Part B premiums for people with Medicare with high income for 2017 are shown in the following tables. So basically, for those whose income is $85,000 or less and file an individual tax return, file a joint tax return with a yearly income of $170,000 or less, or filed married with separate tax returns, the Part B premium is $134 per month. And so basically, again, you can look at the chart here and you can see based upon, again, filing individually, filing joint tax returns, filing married and separate, based upon your incomes, you can see that the amounts basically go up here significantly each month, based upon your income. So definitely refer to the chart to see further on that. So what you pay in original Medicare. Now the basically the yearly deductible is going to be $183. And so that also with the coinsurance for Part B, there's a 20% coinsurance for most covered services like doctor services and some preventative services if the provider accepts assignment, and 0 for most preventative services. Also, the 20% coinsurance for outpatient medical health services and co-payments for medical services. So, decision, should I keep or sign up for Part B? Well, basically, you're going to want to consider, most people pay a monthly premium and usually deducted from Social Security or railroad retirement benefits. The amount depends on income, and also it may supplement employer's coverage. And again, you want to contact your benefits administrator to understand the impact to your employer's plan. Okay, one sec here. So when you must have Part B. You must want to buy a Medicare supplement insurance Medigap policy. So also, if you want to join a Medicare Advantage plan, you're eligible for TRICARE for life or the CHAMPVA. Your employer coverage requires you to have it, less than 20 employees. And again, you want to talk to your employers or union benefits administrator. You have the Veterans Affairs. The VA benefits are separate from Medicare, and you pay a penalty if you sign up late or if you don't sign up during your initial enrollment period. So basically, Part B and active employment, if you don't have coverage from your active employment, your delayed Part B may mean higher premiums, paying for your health care out of pocket, also waiting until the next general enrollment period to enroll. So basically January 1st through the March 31st, which coverage you're not starting until July 1st. If you do not have coverage through active employment, you may want to delay Part B, and no penalty if you enroll while you have coverage or within an 8th month of losing coverage. Okay, so now let's talk about one way to help address some of the costs associated with original Medicare coverage. A Medicare supplement or a Medigap policy is a health insurance sold by private insurance companies to fill the gaps in original Medicare. And Medigap policies can help you share the cost of the co-insurance, co-payments, or deductibles, the cost of the Medicare covered services. And some Medigap policies also cover certain benefits original Medicare doesn't cover. Medigap policies don't cover your share of the costs under other types of health coverage, including Medicare Advantage plans, standalone Medicare prescription drug plans, and employer union group health coverage, Medicaid, and Department of Veteran Affairs benefits, or TRICARE. Also, in all states except Massachusetts, Minnesota, and also Wisconsin, Medicare policies may be one of the standardized plans, A, B, C, D. There's also F, G, K, L, M, or N, so they can easily be compared. And each plan has its own benefits, and they're all the same for any insurance company. So it's important to compare Medigap policies because costs can vary dramatically, and each company decides which Medigap policy it will sell and the price for each plan, which state reviews and approvals, and other differences including pre-existing conditions, waiting periods, and crossover of claims from Medicare administrative contractors to Medigap policies and guaranteeing issues, etc. And so basically, I'm going to go over a bunch of the different types and things that are included in the different policies here. So from the chart here, all Medigap policies cover a basic set of benefits, including the following. All plans cover 100% of Medicare Part A coinsurance and hospital costs up to an additional 365 days after Medicare benefits are used up. And Medicare Part B coinsurance or copayment with plans A, B, C, D, F, G, M, and N, also covering 100% of plan, 100%. Plan N pays 100% of the Part B coinsurance, except for a copayment of up to $20 for some office visits and up to $50 copayment for emergency room visits that don't result in inpatient admission. And Plan K pays 50% of the Medicare benefits B coinsurance or copayments, while Plan L paying 75%. So also covers the blood, the first 3 pints with plans A, B, C, D, F, G, and M, and N covering 100%, and Plan K is 50%, Plan L is 75%. So basically, when we get together, we can go over much more detail which supplement plan may be best for you. In most cases, we're seeing oftentimes a lot of our clients are getting F or G. But again, we can look at that, look at the benefits, discuss which may be right for you. So, decision, do I need a Medigap policy? Well, you want to consider, basically, it only works with original Medicare. Do you have other supplemental coverage? If so, you might not need Medigap policy. And can you afford Medicare deductibles and co-payments? What does the monthly Medigap policy cost? So, when is the best time to buy a Medigap policy? Well, you'll want to consider these things. Your Medigap open enrollment period begins the month you're 65 or older and enrolled in Part B. It lasts for 6 months minimum. It may be longer in your state. And you have protections. Companies must sell you a plan if you're in your open enrollment period. You can also buy a Medigap policy whenever a company agrees to sell you one, and if later there may be some restrictions there. So we basically suggest that to buy a Medicare policy, follow these steps. Set up an appointment with myself or one of our other benefits representatives to review plans and provide quotes. Decide which Medigap plan has the best benefits for you, and apply for that Medigap policy that day if you feel comfortable. Now, Part D, the Medicare prescription drug coverage, is available for all people with Medicare and provided through the Medicare prescription drug plans, also Medicare Advantage prescription drug plans, and some other Medicare health plans as well. how Medicare Part D works. Basically, Medicare Part D is a Medicare prescription drug coverage, and Part D coverage is provided through Medicare prescription drug plans, PSDs, and Medicare Advantage plans with Medicare prescription drug coverage. And there are some other types of Medicare health plans that provide health care coverage which aren't Medicare Advantage plans, but some part of Medicare, such as Medicare cost plans and programs of all inclusive care for the elderly. And some of these plans provide Medicare Part A and B coverage, while others provide Part B coverage only. And some only provide Part D. And these plans have some of the same rules as these other plans, no problem. As you will see later in the presentation. However, each type of the plan has special rules, exceptions, and so you should consider any plans you're interested in to get more detail. Okay, moving right along here. Who can join Part D? Now, you must have Part A and or Part B to join a Medicare prescription drug plan, have Medicare Part A and Part B to join a Medicare Advantage plan with drug coverage, have Medicare Part A and Part B, or only Part B to join a Medicare cost plan with Part D coverage. Live in the plan's service area, not be incarcerated, and not be unlawfully present in the United States, not live outside the United States, and you must join a plan to get drug coverage. Now, when can I enroll in a Part D plan? During your 7-month enrollment period, during the yearly open enrollment period, which is October 15th through December 7th each year, and coverage begins January 1st. And you may be able to join at other times, depending on Medicare Advantage disenrollment period and special enrollment periods as well. And for example, anytime you get extra help. So now choosing a Part D plan, you'll want to review and compare the plans with your senior benefits representative. And then to join a Part D plan, you'll want to basically complete a paper enrollment form. In some cases, there could be an electronic way to do that. Just get with your benefits representative to help you with that. Now, decision, should I enroll in a Part D plan? Well, the things to consider, do you have credible drug coverage? Coverage as good as Medicare's, for example, through an employer plan. No penalty if you have credible drug coverage and delayed enrollment in a Medicare drug plan. And will that coverage end when you retire? How much do your current drugs cost? What do the premiums cost for Part D plans? And without credible coverage, late enrollment may mean you pay a penalty if a penalty of 63 or more days in a row lapse. With Part C Medicare Advantage, health plans options approved by Medicare, another way to get Medicare coverage. You still have part of the Medicare program. It's run by private insurance companies. And also Medicare pays the plan in amount for each member's care. So basically you may have to use, you may have to use the network of doctors or hospitals. And the type of plans may vary. So again, very important with Medicare Advantage plans to know that you can't just go anywhere you want, such as if you are on original Medicare, Part A and B, you may be limited to certain doctors and certain hospitals. So again, that's one thing to take significant note of when you're talking with your representative to see which may be the best coverage for you. And how does Medicare Advantage plans work? Well, if you join a plan, are still in Medicare with all the rights and protections, you still get those services covered by Part A and Part B, but the plan covers those services instead. and basically may choose a plan that includes prescription drug coverage. You may also have different benefits and cost sharing, and may choose a plan that includes extra benefits such as a vision or dental offered at the plan's expense, not covered by Medicare. Now, when and how can I enroll in a Medicare Advantage plan? Well, generally during your initial enrollment period. You also during the yearly open enrollment period, which again is October 15th through December 7th each year, and coverage begins January 1st. It may be able to join at other times, again based upon the special enrollment periods. And again, just contact us to review and join a plan. Now, should I join a Medicare Advantage plan? Basically, again, things to consider here. You must have Part A and Part B to join. I must offer comprehensive coverage, including Part D drug coverage. Some plans may require you to use a network. You may need a referral to see a specialist. Another important thing to note there. And you must pay the Part B and the monthly plan premium. And you can only join or leave the plan during certain periods. It doesn't work with any Medigap policy, so you can't have a Medicare Advantage plan and also have a Medigap plan or Medicare supplement. Again, very, very important to note that. It's not available to most people with end-stage renal disease. So basically, here's a chart, kind of goes over, decision comparison summary and how they work. Again, Ken just goes over some of the topics of that. If you want, pause the video so you can look over that. And basically, this slide here again just shows again how Medigap policies and Medicare Advantage plans differ. So again, just take note of that, look over that, pause the video. And Medicare and the health insurance marketplace. Now, Medicare isn't part of the marketplace. And if you have Medicare, you're covered and don't need to do anything related to the marketplace. So the marketplace doesn't offer Medigap or Part D plans. And it's against the law for someone who knows you have Medicare to sell you a marketplace plan. And so even if you only have Part A or Part B, marketplace and becoming eligible for Medicare. Now, you can keep a marketplace plan after Medicare coverage begins. So once your Medicare Part A coverage starts, you'll no longer be eligible for any premium tax credits or other cost savings you may be able to get for your marketplace plan. So you'll have to pay full price for that marketplace plan. So sign up for your Medicare during your initial enrollment period, or if you enroll later, you may have to pay a late enrollment penalty for as long as you have Medicare. Medicare for people with disabilities, and after the marketplace, you may qualify for Medicare based on a disability, and you may be entitled to Social Security disability insurance benefits for 24 months. And on the 25th month, you'll automatically enroll in Medicare Part A and Part B. And if you're getting Social Security disability income, you can get a marketplace plan to cover you during your 24-month waiting period. You may qualify for premium tax credits and reduced cost sharing until your Medicare coverage starts. So basically, choosing a marketplace instead of Medicare, you can choose marketplace coverage instead of Medicare under certain following conditions. If you're paying a premium for Part A, you can drop your Part A and Part B coverage and get a marketplace plan instead. Only have Part B and you have to pay a premium for Part A. You could drop Part B and get a marketplace plan instead, and you're eligible for Medicare but haven't enrolled in it because you'd have to pay a premium for Part A. You have a medical condition that qualifies you for Medicare, like ESRD, but haven't applied for Medicare coverage, you're not collecting Social Security and retirement or disability benefits because you're eligible for Medicare, and you're in your 24-month disability waiting period. So basically, help for people with limited income and resources. There are Medicare saving programs that help from your state paying Medicare costs, including Medicare premiums, deductibles, and coinsurance. There's extra help, basically paying for Part D prescription drugs. There's Medicaid, which is again a federal state health insurance program for people with limited income and resources. There's also CHIPS health insurance program, which again at the Children's Health Insurance Program, also known as CHIPS. Coverage basically uninsured children up to age 19 and may cover pregnant women. And you have family incomes too high for Medicaid. So basically this chart here just shows the difference between Medicare and Medicaid. Again, you can pause the video to kind of see the difference there between the Medicare and Medicaid. And then this shows basically your costs associated in 2017 with your Medicare savings program income and resource limits. These are some great helpful websites to check out. Again, pause it here to note these. And feel free to go over and check out those and all the resources available on those sites. And then key points to remember: Medicare is a health insurance program. It doesn't cover all of your healthcare costs. You have choices in how you can get covered. There are programs for people with limited income or resources. Decisions affect the type of coverage you get, and certain decisions are time sensitive, and you can get help if you need it. Now, again, I'm Mike Ward with the Ascension Group. Definitely contact myself or a senior benefits agent here today. You can go over to set up an appointment with us. Just go over to our website at protectmydreams.com/Medicare. And you can also call me at 469-853-5696 to set up an appointment, get all your questions answered, and we look forward to helping you protect your dreams and passions through life's journey. So thank you very much here today, and I will see you here soon. Take care, and be sure to watch our other videos. Have a great day.